Hello everyone. I welcome you all. I'm Dr. Taskeen and I welcome you all on Homeopathy Musing. So today's session is on anorectal diseases and its homeopathic management with Dr. Zubin Dehmeri. I welcome you, sir, on Homeopathy Musing. Before we move on to today's session, I just want to brief you through the upcoming sessions on our platform. So to honor the World Heart Day, we'll be having a special session with Dr. Adil Chimtanwala, sir, on homeopathic management in cardiovascular diseases. It's on the 10th of October. It will be a 2-hour session. We are planning to start a new course, the basic course, where there will be an integration of both the classical and contemporary homeopathy. This is the version 3 of the basic course, and it will be starting from the 14th of October and will be having total 15 sessions. We also have the animal retreat as a part of our ongoing animal module, which is a 1-year program. And in this retreat, it will be an in-person retreat at Hidden Oasis near Pune. And it will be a 3-day retreat from the 13th of December till the 16th of December, where we'll be studying the bird group of the animal kingdom. And a lot of activities have been planned. A lot of self-healing activities have been planned. So do join us for the retreat. I highly encourage and recommend you all. Before we move on, I would like to introduce Sir Dr. Zubin Dehmeri. He's been practicing homeopathy since the past 15 years now. He has a special interest in various skin disorders, autoimmune disorders, psychiatric conditions, and pediatric conditions. He has been trained and has worked under the guidance of renowned homeopath Dr. Farooq Master. He has recently been working on palliative care with homeopathy in cancer cases, and he is keen and eager to spread his knowledge of classical homeopathy to the practitioners of homeopathy. I welcome you, sir, on our platform, and I'm glad that you are taking today's session with us. And we hope to learn a lot of things from you. Before we move on, I just want you to brief you through certain things. Do keep your lines mute all the while the speaker is speaking. Please do not scribble on the screen. It's very distracting for the speaker. You can make notes. In case you have any questions or queries, you can write in the chat box and we'll address it at the end of the session. Without wasting any more time, we can start with today's session. In case of any questions or queries, you can feel free to contact us on Homeopathy Musing. And we have been flashing the numbers below. You can contact us on these numbers as well. I'll stop sharing and then I invite Sir to come ahead and share.
Thank you, Dr. Tuskin, for such a nice introduction. And I'd like to thank Healing Harmony for giving me this opportunity to speak today. And I would especially thank Dr. Prajakta Vaidya and Dr. Preeti Shah for allowing me to speak today on this platform. So today I'll be sharing with you some experiences of mine in treating some anorectal conditions with homeopathic medicines. So I'll be sharing with you 2 such cases where the treatment advice was surgical, but patients were negligent to undergo surgery and homeopathy had helped them. So can I share my PowerPoint now, Taskin?
Yes, sir, I have given you the access. You can go ahead.
Okay. You can see the PowerPoint? Yeah.
Yes, sir, we can see.
Okay. Yeah. Yeah. So before I move on to the cases, I would like to share some philosophical aspect what our masters used to do in such cases. Let us dive into some miasmatic, which miasms do appear when we are treating such anorectal conditions. So I refer to the book called The Chronic Miasms by Dr. John Henry Allen. In this, he has said that all rectal conditions, mainly hemorrhoids, they belong to a tubercular miasm. Also, it can be a psychotic miasm when there are scanty, thin and watery discharges with offensive or fishy odor discharges from the anus. So it could be a tubercular miasm or a psychotic miasm. And also when the rectal conditions are alternating with the other conditions of the heart, chest or lungs, they are mainly of tubercular origin. So he gave some examples like hemorrhoids, if they are operated upon, the patient can develop a lung condition called asthma or some heart conditions like hypertension. So according to Allen, mainly it's a tubercular miasm, any anorectal condition. Also, rectal strictures, fistula, and sinuses are all tubercular in origin. The prolapse of rectum in children are again of tubercular miasm. Then the growths of rectum, like cancers of rectum, they can be either tubercular with some psychotic elements combined. But he has specified that whenever you start treatment with anti-tubercular, anti-psychotic remedies, you should end your treatment always with some antisoric remedy to complete the cure. Then what Dr. J.T. Kant has to say in his book called What Doctors Need to Know in Order to Make Successful Prescription. He says in the section of anus and rectum, so when you're taking such cases, you have to notify all the sensations and pains with any bleeding, eruptions, itching related to the fissures, fistula, anus or warts or around the rectal area. So when you're treating piles, you should note in detail the appearance of the piles, color, size and shape. If there is a prolapse, you must know the cause of that prolapse, any aggravating factors leading to prolapse, and any concomitants associated with the rectal conditions, maybe diarrhea or constipation, which lead to piles, or any operations or surgeries or any injections done in the piles condition. So he has mentioned all the detailed questions we need to take while treating such anorectal conditions. Okay. So this was a short description of Dr. J.T. Kant and Allen on how to approach such anorectal conditions. With this, let's begin our first case. So this was a case of a 9-year-old boy who was brought to me by his parents on 1st of September 2023 with complaints of bleeding per rectum. The rectal bleeding started, at 1.5 years of age, the child had itching of anus and had to strain a lot for stool. And he was diagnosed to have a first degree, what we call a mucosal prolapse of the rectum. The first episode of rectal bleeding was at the age of 6 years. So initially had a mucosal prolapse. Then later on, the first episode of bleeding happened at the age of 6 years. He had taken some allopathic treatment. Since that time, the bleeding of rectum is happening every 3 months. And there's a lot of itching in the rectum and anal area. The bleeding is with stool and is of bright red in color. There's a lot of itching in the anus and the rectal area, which is worse after stool. And last episode of bleeding when he came to me was around 7 days back. Recently, he was also treated for diarrhea by the pediatrician. In the past, he has history of dengue fever 3 years back. In the family history, there is a strong history of abdominal cancer, IHD among grandparents, and the child, he's the only child of both the parents, but parents, they don't have any other illnesses. In generals, when I ask the question, there's a strong craving for pizza, burger with cheese. And stools are very hard in nature, which causes bleeding per rectum according to the mother. Perspiration is mainly on forehead and chest. In sleep, he sleeps mainly on abdomen and he keeps talking in sleep. Thermally, the child is very hot. He loves air condition He does not cover himself in sleep, and there is a lot of tendency to catch cold frequently. So when I asked about the mind symptoms, so according to the parents, the child cannot sit at one place for long. He keeps on moving about, though he is an obedient child. He keeps on running about and keeps changing his position. He's a very animated and very expressive child, according to the mother. He has a lot of fear of dark and ghost. He loves to play cricket. He likes watching cricket. He likes to travel, mingle with people. He does not sit at one place even at school. So he's quite restless as a child. He does not sit at one place. Mostly it is a physical restlessness. In pregnancy history of mother, I asked, she said it was an LSCS cesarean section delivery at 39 weeks, full term, as she could not bear the labor pain. In emotionally during pregnancy, the mother said she had no emotional support during pregnancy. She did not have anyone around her during the pregnancy and used to feel alone and anxious. She could not breastfeed the child as she could not get the breast milk and used to top fill the child whenever needed. Earlier, she was working as a manager in some Coca-Cola company. After marriage, she left the job for which she used to feel bad about it. So on physical examination of the child, pulse was regular, no pallor edema or no lymphadenopathy. Child was very well oriented, used to respond well to all the questions. Systemic examination of abdomen revealed no abnormality. Chest was normal. On local examination of perineum, I saw there is no eruption, no prolapse of rectum, visibly seen on coughing or straining for stools. So this was a case of a child. So now I started evaluating the case. So when you start evaluating, you should know the causes of bleeding per rectum. So bleeding can be due to anything from cancer to simple hemorrhoids or fissures. Since the child had already gone to the pediatrician, it was diagnosed bleeding to be due to mucosal prolapse of the rectum due to hard constipated stools. So analysis of physical symptoms was hard stools with constipation, bleeding in stool, prolapse of rectum, and bleeding per rectum. So whenever I analyze a case with physical symptoms, I try to look at the psychological aspect, what leads to this physical symptoms. So when the person is having a hard stools or constipation, subconsciously there must be some unconscious refusal to let go or some fear of unknown, or there is something in his life which he wants to control a lot. He's trying hard to control. So what was the thing in this case? So since the child had problems in 1.5 years of age, took into consideration the psychological state of mother during pregnancy as well. So during pregnancy, as stated earlier, the mother had said that she had no emotional support during pregnancy. She did not have anyone during pregnancy, and that's why she used to feel alone and anxious. So there is a lot of anxiety and fear related to pregnancy when she was pregnant. She was not aware what to do after the child is born, how to bring up the child. And also there was a thing going on that she left her career and future after marriage, for which again there is some uncertainty revolving in her life. So a lot of fear of unknown was seen during the state of pregnancy in mother. So let's analyze the miasm of the case. Since there is a bleeding in stool, I took into consideration the tubercular miasm, and because of the constipation and mucosal prolapse and hard stool, they all belong to the psoric miasm. Miasm in family, since there is a history of cancer and IHD, mainly psora and syphilis was considered. Now let us analyze the mind symptoms of child. So when I analyzed the symptoms, I found the child to be restless, animated, playful, and afraid of dark and ghost. and he used to talk in sleep. In general symptoms, the child had a desire for cheese, as seen in craving for pizza and burger with cheese. Sleeps on abdomen, lean child. Physical constitution of child was lean and thin, and there's lot of tendency to take cold. Thermals, the child is very hot. In physical symptoms, I took rectal prolapse with bleeding, which is bright red from the rectum, bleeding due to hard stools, with itching of anus and rectum, which is worse after stool. Taking these symptoms, I repertorized the case. In repertorization, I took the following rubrics, as you can see, of mine: fear of dark, fear of ghost, playful child, restless child, talking in sleep, vivacious, since he was very animated child, like sleeping on abdomen, tendency to take cold, history of cancer I took, desire for cheese, hot child, and lean as a lean constitution. In rectum symptoms, I took in repertory hemorrhage from anus of bright red in color, hemorrhage from anus due to hard stools, itching of anus or rectum after stool, and prolapse of rectum. So, depending on these symptoms, what remedy is to be given? So whether we have to prescribe for the pathology symptoms, just covering the prolapse and bleeding and the constipation, or do I prescribe on the constitution symptoms of the child? So since the disease started in a child since 1.5 years of age, it's a very chronic one. And the bleeding is usually very scanty and intermittent in nature. So we need to treat the constipation on the hard stools of the child in order to get rid of the rectal bleeding and to resolve the rectal prolapse of the child. Also on physical examination, the child is quite okay. There were no deteriorating of his vitals. There is no anemia also. So there was no need for urgent intervention and to give the acute prescription. So basically, my prescription would be of a constitutional remedy in this case. So this was a remedy given. So this is a picture of a bacilli, which is very common cause of the illness, mainly in India. It causes tuberculosis. So it's a tuberculin bacilli. So remedy obtained from it in homeopathic practice is tuberculinum bovinum, which is obtained from the lymph glands which are infected with tuberculosis in cattle. So this was my first prescription on 1st of September. I gave him tuberculinum bovinum 200, just 1 dose a week, and asked mother to repeat the dose once a week if the bleeding happens again. Also, I gave some dietary advices like to increase the water intake of the child, include more fiber in diet with fruits and vegetables, and to avoid junk food, and ask them to come for follow-up after a month's time. So let's see what happens in the follow-up. So they saw me again on 2nd of October after 1 month. Child had taken 2 doses of tuberculinum 200, 1 week apart. After that, the mother says there is no bleeding per rectum. Stools are much better. Also, the cough cold is not there, which he used to get recurrently and frequently. Since there was general amelioration, I prescribed placebo for 1 more month to the child. On repeated follow-ups, I saw the child that for 6 months, and for 6 months there were no bleeding and no constipation. Now, after a year, the child came to me for cough and cold episode with no bleeding per rectum. The bleeding rectum never happened again, for which some acute remedy was prescribed by me, and I followed up with 1 dose of tuberculinum 200 again. So this was the end of the case, which got treated very well with tuberculinum 200. So let's see what led me to prescribe the tuberculinum in this case in detail. So the tuberculinum covered the following symptoms of restlessness of child, dark fear of child, talking in sleep, sleep position and abdomen, lean and thin constitution of the child, and tendency to take cough and cold, along with the particular symptoms of itching and hemorrhage from rectum due to heart stools were also covered by tuberculinum. So why tuberculinum? So tuberculinum is a very restless remedy, but the restlessness is not like arsenic restlessness. The restlessness in tuberculinum is mainly due to desire for change. He desires to move about, he desires to go out, he wants to change the current situation in his or her life. He does not want to stay in one situation for long. Also, there is a lot of fear of unknown. So when he changes his situation or places, he has a fear of unknown. He does not know what will happen next. So when he goes for adventure or some road or journey or destination, there is a lot of fear of unknown. And always the patient is relieved by motion, whatever the complaints are. So in this case, desire for change and fear of unknown was a mental state of mother during the pregnancy. There's a lot of uncertainty in mother's life. So that's why there was fear of unknown. Sorry. And desire for change, which got reflected as restlessness in the child. The tuberculum person, we can see changes in his temperament also. At one moment, he can be angry, and one moment, he can be good. In one moment, he can be cheerful, and one moment, he can be melancholic. There's a lot of mental work aversion. He does not like to do mental of work because he likes physical work, because motion relieves him a lot. So any kind of motion like Rustox makes the tuberculum patient better. So there is a lot of aversion to mental work, which could be due to the restlessness, mainly the physical restlessness in tuberculinum. Also, tuberculinum has fear of dogs. There is a lot of cursing and swearing can be seen in tuberculinum patient, and is very sensitive and irritable person and can be very reckless, who cannot take care of what he is doing. In tuberculinum, we see there is a lot of desire for traveling and he's very adventurous. Since he likes changes, he's always on the move or always in the go. Physically, the tuberculum is chilly, but there is a strong desire for fresh air or cold air. In dreams, we see there are a lot of frightful dreams, vivid dreams, and shameful dreams in tuberculinum. Physical constitution of tuberculum are they are very lean and thin with light complexion and narrow chest individuals. They may have a blue sclera or conjunctiva, and there's a constantly changing symptoms. So change can be seen emotionally as well as in physical symptoms also. There's a lot of tendency to take cold. In tuberculinum, the child, though he's eating well, he loses flesh. Means he is emaciated even after eating well. Also, tuberculinum can be indicated when the well-selected remedies fail to improve the case. So, changing and unsatisfied symptoms are strong indications of tuberculinum. As I told you earlier, desire for open air, cold wind can be indicated for tuberculosis, mainly affecting the apex of left lung. Skin conditions of ringworm mainly seen in patients with tuberculosis according to Burnett. In again, tuberculinum has many symptoms similar to that like of rustox, like standing aggravates is like like sulfur, like standing aggravates in sulfur. In physical symptoms, tuberculinum can be a good remedy in osteoarthritis or any joint conditions which are better by motion, like rustox. But how to differentiate in rustox? the patient is better by motion but is worse from cold, while tuberculinum is better by motion and is worse from heat. They desire cold application and cold air in tuberculinum. Any change of weather or temperature can aggravate the tuberculinum patient. So any change from heat to cold or cold to heat can be the aggravating factor for tuberculinum. Tuberculinum can also be aggravated in cold and damp and hot weather. So any damp weather also aggravates tuberculinum again. He is always better in fresh open air. There can be craving for cold milk or sweets and aversion to meat. Though there is tendency to take cough and cold, the tuberculinum person will desire cold water. There is a thirst for large quantities of cold water in tuberculinum. So in skin conditions, tuberculinum has a lot of crops of boils with greenish discharges, history of recurrent boils. So it's very similar to sulfur in skin affections also. In head symptoms, it can be a good remedy for headache of children, especially school-going children, worse from any mental exertion and study. So they don't like mental exertion. They're better by physical exertion. Can be good remedy for diarrheas, mainly morning diarrheas when sulfur fails. According to Kent, tuberculinum bovinum is a deep-acting antisoric remedy. It is a long-acting remedy and affects the constitution more deeply than most of the remedies. So when the deepest of a remedy act for only few weeks, that have to be changed. This remedy comes when the symptoms agree, they bring about a state of reaction which holds longer for a longer duration. So it is a very deep acting antisoric remedy, tuberculinum bovinum. Fine. So this was a case of rectal prolapse with bleeding, got treated with tuberculinum. And I described in short the indications for tuberculinum in general related to case and the other indications as well. So if anyone has any questions related to this case, one can share or say. Tuskin, they can ask questions, no, right now? Viewers?
Yes, sir. You can
Yes.
raise their hand. I can unmute them or write it in the chat box. So someone is requesting for a full screen of your presentation.
Full screen of PPT.
Yes.
So,
So can you please show family myasm slide again? Asked by Khushbu Agarwal.
family myasm slide. Okay. 1 second. I'll just. Yeah. So,
What was key point to
uh,
differentiate Rostock in motion?
so rust ox, they are better by motion, as you all know. Even tuberculinum is better by motion. But rust ox is a chilly remedy. So all joint pains or any physical symptoms are worse in cold air in rust ox, while tuberculinum are better in cold or open air. So that is the differentiation between the rust ox and tuberculinum in physical symptoms.
Khushbu asked, I also wanted to ask, tuberculinum is deep acting. So is it necessary to repeat every week?
Not necessary. It depends on the improvement of the case. So if you can see, I just repeated 2 doses of tuberculinum initially. So no need to repeat. If there's an improvement, if there is no improvement or there is stoppage of improvement, you can think of repeating it uh, over a week's time or a 15 days time as you need it. But usually we don't repeat that much. Yeah.
Any
Any
other questions?
yeah,
If not, then we can go ahead. Can you discuss mind more of tuberculosis?
okay. So I told you earlier the tuberculum, they always desire change. So it could be a physically also and mentally also. So they cannot sit in one position physically, but even mentally, the patient, they usually are very inconsistent in their career, their profession, or their mindset. So they always want change. They want to try something new. Because of that, they develop some fear of unknown or uncertainty is always there in their life. So that is the main essence of tuberculinum. So if you don't see that change or uncertainty, very hardly you will get tuberculinum as a constitution. So that even Dr. George Vitholka says that they are very uncertain individuals in their career, profession, or in their mindset. They always want some change. They always want some adventure or want to try something new in their life. So they don't even like to take responsibility for a long time. When to go to bacillinum over tuberculinum? See, honestly, I don't know much about bacillinum constitution, but even mainly if the skin conditions are more like ringworm or fungal infections with tubercular constitution, you can try and think of bacillinum as a remedy as well if tuberculinum doesn't work. But the constitution aspect, I really don't know. Dr. Burnett used to give a lot of bacillinum as specific basically, and it used to work really well for him. Okay, can we
Yes,
move on to
yes, sir.
next?
I can think. I
Yeah.
think we are done with the questions so far.
So I'll discuss the second case to you. This is more deeper pathology. So again, this was a case of a 14-year-old boy. His mother is actually a homeopath herself, but she doesn't practice and they stay in Saudi. So they usually consult me for his problem or their family problems. So initially I consulted the boy over the phone. He had some abscess or boil in the axillary area and the perianal area, for which I had given many acute remedies, but none of them seemed to help him much. Okay. So it initially began with the swelling in the axillary area and the perianal area. And this swelling and discharge was there since 6 months. So mother, mainly the history is given by mother herself. The boy has pain in rectum, which is worse while passing stools. And the boy never complains of anything. He says that everything is okay with me. So mother, please don't bother me. I don't want any remedy. That is what the mother says, that he never asks for help, even after this condition. So mother says there's a lot of purulent discharge from the axillary area and also from the perianal area on inspection. Discharge is of copious in nature and she has to literally clean with gauze piece every 4 hours. With this discharge, there's a lot of shivering with coldness sensation, which is worse after the stools. So initially, it started as a boil in the armpits, then boils on buttocks, and later it turned into abscess. So initially, the eruption was very small, and it then turned into a large abscess. Then gradually, the abscess burst open and developed into sinus in the axillary area, and later fistula in the perianal area. So discharge is of yellowish to pale greenish or creamy in color. Then I moved on to family history. The father of boy had died in October 2022. He was a known case of diabetes with hypertension and was on dialysis due to chronic renal disease due to diabetes and hypertension. So recently the father of the boy had died in October 2022. Mother has, sorry, mother has complaints of lumbar disc prolapse and history of tubercular osteomyelitis. Patient's elder brother is asthmatic and a strong history of diabetes, hypertension, and cardiac problems among grandparents and even asthma. In the past, the child was treated with homeopathy for asthma. In physical generals, the child has a lot of craving for meat, coffee, and cold drinks. Stools are very hard. Lot of perspiration in armpits, buttock areas, and which are profuse in nature. He gets dreams of his dead father. In sleep he is disturbed due to pain of abscess in the perianal area. He tries to sleep on left side more because on that side the pain is little less. In thermals, the child is very hot, boy is very hot. He loves winter, loves AC, and he can tolerate AC and fan as well. In concomitants, there is headache from traveling and worse from strong odors, and the cough is worse from smoke. Now let's move on to the mind symptoms. When I asked the boy about his problems, he said that he feels very disgusted due to his problem of abscess and discharge from it. So he doesn't like the discharge because it is very bad and ugly in appearance. He doesn't like it. He does not share his emotions. He suppresses his emotions and he does not want to complain to anyone about his problems. According to mother, he weeps when alone, always plays with his mobile, different shooting games. He gets very angry if been contradicted or been told something by mother to do. He's very argumentative, would quarrel and argue with mother a lot. Mother says that he was very close to his father. Loss of father has affected him a lot. So death of father has a big emotional role on him. It's affected him emotionally a lot. He desires to be alone and he does not want to socialize with friends. And mother, as a mother, she says, I'm very strict. He likes to be in beaches, seaside. He's afraid of reptiles, snakes, lizards, and cockroaches. He loves cats. He likes outdoor activities like football. He has a strong aversion to bathing. According to mother, more on his mind symptoms, he is mildly suspicious and jealous. He's very suspicious of others and he's very jealous of his brother, according to mother. He remembers hurt caused by others and he feels revengeful. He wants to get back to them. He dwells on it, how to pay them back. He's a very proud person and will not make friends easily. He feels depressed due to his father's death, but he does not like to express his grief or emotions to others. He's very self-conscious about his appearance and he always wants to make a good impression of himself to others. So that's why when I asked him, how are you? He said, I'm okay, nothing is bothering me. Don't worry about me. He usually shouts at and screams with anger. He's very short tempered and he cannot control his anger. He gets very easily irritated. He does not like opposition to his views and he's very argumentative. He likes to win argument. As a child, he was pampered a lot by his father and even his elder brother, who is very tolerant of his temper tantrums and outbursts. Mother says, I'm the one who sets boundaries. That's why he hates me. He loves going to school. He used to love going to school, but now recently, due to father's death, he has stopped doing that. He likes playing football with friends every day. But after father's death, all this has changed. He likes to be at home and just play with his mobile and PlayStation. So father's death has affected him a lot. Currently, he feels terribly sad about his father's loss and that life cannot be like before and things has changed forever. He also feels sad that elder brother may move to the other country for studies. So stories like the elder brother is also moving out to pursue his higher studies to US. That is also bothering him because there will be no one left. His father has died, brother is going away, and he'll be left only with his mother. So he feels there's a lot of uncertainty going on now, and that is affecting him a lot emotionally. So when I inspected him, he had a small mole on neck. There's a dryness of lips. So 2 months back, mother had shown to some surgeon at Saudi where he was diagnosed to have right axillary hidradenitis suppurativa, which is the inflammation of the sweat glands in the axillary area, along with the anal region fistula. Surgery was advised to mother, but the prognosis was very uncertain. The surgeon was not confident whether the surgery would be of any help. He had already been given antibiotics for the discharges, but there was no improvement seen. So what is hidradenitis suppurativa? Is a autoinflammatory condition which affects the hair follicles, causing recurrent abscesses in the sweaty areas, mainly like axilla. So it can cause nodule abscess or sinus tract with scarring. And it is not contagious or infectious. Fistula in ano, as you all know, it's a tract connecting two openings, one outside and one inside the anal canal. It could be single or multiple. So let's move on to the mechanism of case. So since the discharges are very copious, discharges mainly of greenish yellow in color, it could be either tubercular or psychotic miasm, acute miasm. While the miasm of family, as you can say, there's a lot of destructive disease like heart disease, diabetes, renal failure, and asthma and osteomyelitis, pointing towards syphilis mainly and psychosis. So let's analyze his symptoms. So I took following physical symptoms of the boy. I took in general the abscesses which are yellow and greenish in nature, thick discharge of abscess, location of abscess around perianal and axillary area, fistula in ano, along with the rectum pain during stool, concomitant of head pain from strong odors, chilliness after stool. In physical generals, there's a lot of perspiration in axillary and the gluteal nates area. Sleep is disturbed due to pain of abscess. There is tendency to develop boils and abscesses. Aversion to bathing, hot patient, desire for coffee, cold drinks and meat, and profuse perspiration. In mind symptoms, I took following symptoms. I took mainly the ailments from that of loved ones, mainly the loss of father, death of father, which has affected him a lot. As a person, as you can see, is very argumentative. So I took dictatorial, quarrelsome, and haughty as a person. He does not like company, tries to suppress his emotion. He hates people who offend him, like his mother, his own mother, he does not like. He's in contra- he does not like contradiction, makes him angry. He's lot of fears of insect, reptiles, and snakes. Love for cats. Indecisiveness. There's a lot of uncertainty which we can see. He's afraid of future, which is hurting him a lot. He likes beaches, seaside, and dreams of dead father. So I repertorize first the local symptoms. As you can see, I took abscess in general of yellow, thick in nature. In general, I took fistula, abscess in axilla area, pain in rectum during stool, and boils in axilla area. You can see some acute remedies coming: HIPAA, silicia, murk, sulfur, lyco, and calcarea sulf. Then I repertorize the mind and general symptoms. I took ailments from that of loved ones, mainly parents or friends, anger from contradiction, love for cats, company aversion, is very dictatorial, as I told earlier, suppresses his emotions, fear of insect, reptiles, snakes. There's a hatred for person who has offended, like you see hatred for mother, haughtiness, irresolution, uncertainty, indecisiveness, quarrelsomeness, better at seaside, and dreams of that father, relatives I took, chill after stools, averse to bathing, and hot as a person. Other concomitant generals which I took were head pain worse from odors, cough from smoke, perspiration axilla, perspiration profuse, desire for coffee, meat, and cold drinks. Then I combine all the physical generals and the particular symptoms and arrived at the repertorial totality. As you can see, deep acting constitutional antisorics are coming basically like sulfur, lyco, calcarea, sepia, natrum, murk, lachesis, and phosphorus. So there are a lot of maze of symptoms you can see. I tried prescribing mainly on particulars, acute remedies like hippar, calcarea, murk, calcarea sulf, but of little or no help to the boy. So which remedy to give? Question arises, how frequently to repeat the remedy and how do you assess the follow-up after giving the remedy? Since the condition is very pathological, you need to give instant relief as well. You can't wait much because there's a lot of discharge, oozing. It can lead to more infection and sepsis as well. And antibiotics are of no one little help, and they have arrived to me for help with homeopathy. So this was a remedy given by me. As you can see, this is a picture of snake. It is a American bushmaster snake called Surukuku, the lachesis. I gave the boy. So per first prescription was of lachesis 200 on 1st of July. Sorry, there's an error in date. It's 2023. Uh, it's 2023, not 24. Third cup, I gave 1 teaspoon twice a day for 7 days. So in such acute pathology, I give deep acting remedy in repeated dilutions frequently. So we get a faster results. So on 8th of July, when I saw the patient after a week, there is no change in symptoms. Discharge is persisting from perianal and axillary area. So I increased the dilution or repetition of lachesis 200 to 4th cup, 1 teaspoon, twice a day for another 1 week. So after a week, the axillary discharge is same, but anal fistula discharge is much better after lachesis 200. So I repeated again lachesis 200 5th cup, 1 teaspoon twice a day because I wanted more improvement in the child, in the boy, sorry. On 29 July, when I saw the boy, the axillary discharge was still persisting. The anal discharge was much better, but there was a standstill. It was not improving further. So I increased the potency finally to 1 m and I gave from 2nd cup twice a day for another 1 week. On 5th of August, when they came, the perianal fistula discharge and pain, they say, are better by 40%. But still, I continued lachesis because pathology was still there. From to 3rd cup, 1 teaspoon twice a day for 1 more week. After that, patient was much better. The axillary discharge was reduced and pain subsided. So perianal abscess, acute pain and swelling subsided and discharge was reduced. So there is much improvement in the pain and swelling of perianal area basically. And even discharge of the axillary area was reducing now. So lachesis help to ward off acute symptoms and discharge. Now after 6 months, the patient is healing, though there is scarring with healing. So perianal discharge is very minimal or negligent, and there is now scar formation around the fistula area and even the axillary area, but no discharge is there. no or very minimal discharge. So whenever there is a standstill in improvement, I give intermittent doses of sorinum 200 and 1 m so that there is a any block, anti-miasmatic block can be removed with this sorinum. So antisoric remedy. So how lachesis help? Lachesis helped in treating the pathology and it also worked as a constitutional remedy. So earlier remedies like Hippar, Silicia, Calcarea sulf were of little or no help, which were just based on pathological totality of symptoms. So lachesis covered not only the pathology of the case, but it also covered the mind and the physical generals of the boy, and it helped in a much better way in bringing about the improvement where antibiotics were also not of help. And definitely surgery is of uncertain prognosis. Recently, I saw the boy again on 8th of August of this year. So axillary discharge is very scanty and there is no pain now. Anal fistula discharge is present, but very scanty. Occasionally it happens. Pain in and around anal area is there, but they are very tolerable even after stools. So still the case is improving and we are still, there is no complete cure, but definitely there is a road to recovery in this case. So let us understand what led me to prescribe Lachesis muta. As you know, the remedy was first introduced in our homeopathy by Dr. Constantine Herring, who proved this remedy on himself. So lachesis is related to case. According to Herring guiding symptoms, lachesis has lot of abscesses everywhere. So there could be fistulous abscess near the anal area. So it can be indicated for abscess with destruction of the deeper tissues and muscles. So this is a perianal area with a lot of destruction which can lead to fistula and abscess formation. It's a good remedy for carbuncles. Abscesses anywhere like liver, glands, lungs, brain, ovaries, etc. There could be gums and tonsillar abscess. Abscesses which are hard to mature and even acute abscess. As you can see in this case, the abscess was very long time and was not responding to any acute remedies. So they are very hard to mature abscesses. It is the only remedy indicated in spinal abscess in BBCR repertory. So lachesis has number of time cured fistula and ano according to Kent when there is a associated hammer-like feeling. Sorry. Hammering pains are there in the fistulous area. Very painful fistulas. So a lot of hammering pains in the rectum, think of lachesis. So like hammering pain can be associated with the fissures or fistula or hemorrhage. So any rectal conditions with hammering pains, think of lachesis. Let's jump into characteristic of lachesis as a snake, which helps us to correlate with this pathology. So it's a bushmaster belonging to Central and South America, also known as Surucucu in Brazil, and first proved by Dr. Herring, Constantine Herring. The venom of this snake lachesis is very destructive. It is a proteolytic. It destroys the tissues and it's a very anticoagulant and leading to hemorrhages and bleeding. And also it can be a neurotoxic, mainly acting on the vagal system. Therefore, we can see a lot of respiratory troubles and cardiac troubles in lachesis. Behavior-wise, these snakes are not very aggressive snakes. They do not bite or strike unless you are very close to them. They have heat sensors in the pit, which they can detect warmth from very far distance. So you can correlate, like lachesis can be very clairvoyant with this physical characteristic of the snake. They prefer cooler temperatures. They are very hot, as you know, lachesis. Like dry areas to live, too much of moisture is bad for them. So any damp aggravation is also seen in lachesis. They're very solitary creatures, usually active at dark. Their habitat is not much known and they are very secretive creatures. So we don't know much about this snake still. They're very secretive. They always arrive at dark time. So as I did in the earlier case, I tried to analyze the emotions related to the pathology. So what does abscess or boil represent emotionally? So abscess or any boil, they usually represent some anger, any repressed anger or suppressed anger that could be due to some event happen in his life. Okay. So there is a lot of sadness and anger associated with this pathology of abscesses and boils. So lacus muta is a muta means silent fade, referring to the tail shaking. It's a type of rattlesnake, but they don't rattle much. That's why it is called muta, lacus muta. So let's jump into mind of lacus. So in lacus, there is a lot of grief ailment. It's mainly indicated for silent grief. They will grieve in silence. They will not say anything to anyone and they will hide their emotions. Okay, so ailments from grief on waking up, lacus is a very good remedy. So mainly the grief is very silent in nature. Even you will not know that the patient is grieving. According to George Vitholkas in Essence of Materia Medica, lacus can be of introverted or sensitive nature. They might never let out their emotions. They can be very secretive. They will not share out their emotions. You will get these people who will not talk. You must understand that this type of silent person can also be lacuses. We always have a picture of lacuses that they are always talkative, loquacious, outspoken, but this might not be always true. Certain situations in life or grief or any disappointment in life can make them very silent and they will grieve in silence, lacuses. So other mind symptoms of lacuses are great loquacity, as you all know, lot of restlessness, and they want to be on the move, does not want to attend the business. They are very jealous as a person with lot of fears, suspiciousness, and they have some feeling of being under influence of superhuman power, some supernatural force controlling over them. Lot of melancholy, sadness, with no desire to mix with the world. They will not go out in the open. As you see in the boy, he has stopped going out, playing football, going to the school, not meeting people. They can be very spiteful or revengeful. They'll get back to you. There are too many ideas which jump from one subject to another. There are many ideas running all the time in the mind of Lachesis patient. Religious insanity and religious melancholy. They try to be more religious after some grief or disappointment in Lachesis. Now, general symptoms, I'll just brush over. Lot of hypersensitiveness to touch, better by heart pressure, worse after sleep. They don't like to sleep. Any sleep or sleeping into aggravation because the lactases poison itself acts on the vagal nerve. So as soon as you sleep, the vagal nerve is depressed more and they get breathless or some cardiac manifestations can happen. They cannot bear anything tight around the throat and waist. All the nerves are very sensitive. They will not bear anything around the skin nerves. Affected parts can be bluish and sensitive to touch. They are better by discharges. Any change of temperature, like cold to hot or rainy weather, is bad for lachesis patients. So they are worse in spring. Any hot weather, when cold to hot is worse for lachesis patient. So any affected parts or inflamed parts are mottled or purple in color. They bleed easily like creosote and phosphorus with dark hemorrhages and left-sided affections. Or the symptoms can go from left and go to right. But reverse can also be true. It can also go from right to left. So it's very undependable symptom, the affection. Craving can be for alcohol, oysters, and coffee, which agrees. So a lot of craving for alcohol is seen, oysters, and coffee in lachesis. So when you study lachesis, very other close remedy is lycopodium. many symptoms similar to lycopodium in lachesis, and lycopodium usually follows well after lachesis. And lachesis is also a good remedy to be followed well after giving some acutes like arsenic, belladonna, and mercury. Fine. So this was a case of perianal fistula and axillary abscess treated with, it's going undergoing treatment with lachesis, which improved a lot with lachesis. And I briefly explained the indications of lachesis related to the case and other indications of mind and physical generals from where you can administer lachesis. Okay, so yeah, this is the end of the case. So any questions related to case, please let me know. Sadia wants to ask question.
Yes, Sadia, you can unmute yourself and ask.
So thank you for the session. Sir, I have a question. In this case of cases, when do we decide that we need to start with the constitutional remedy at first, and when do we decide that we need to start with the specific remedy first?
Okay. So as you can see in this case, I started initially by giving some specific remedies, like it was very acute pathology. Suddenly appeared some abscess in the axilla area and the perianal area. So I tried giving Hipar, Merck as acutes. But even after giving them, if the case is not responding, that is a good indication to take a deeper case taking and to arrive at some constitutional remedy which covers both the pathology as well as the constitution of the patient. So even I did the same mistake by initially giving the acute remedies, with little or no help. Then I arrived at the constitution prescribed. So it's very difficult in this case because the child is not expressing, boy is not expressing. So that's why this thing happened. You got, am I?
Yeah, thank you, sir. And sir, one more question. In this case, we started with cases 200 in water doses, cup
Yeah.
method. So, how important, what I want to know is कि क्या significance रखते हैं पानी में लेना second cup method, third cup method, fourth cup method? Can we
Acha.
directly give the 200 pills in water?
Yeah, see, this method was introduced by Dr. Master when I was working with him. So disadvantage of giving centesimal potency directly is like you cannot repeat that frequently. So if you repeat that frequently, you are bound to get some undue aggravation, or you can get some excess of symptoms other than pathology. So ideally, this method is given for 50 millisimal potencies, as Hahnemann has also done. But Dr. Master has experimented with centesimal potencies and it has worked well. So advantage is that you can repeat it very frequently in urgent cases, mainly pathological cases, where you want quicker results and you can't wait much long. In such cases, we prescribe definitely in a dilutional method using some second, third, or fourth, depending on the susceptibility and the response of the patient.
Okay. And so my last question, from where can we get this data? Like how do we correlate the mental symptoms with the pathology for the first and the second case?
Uh, See, for that, you will have to study psychoanalysis by Sigmund Freud mainly. And some clinical experiences shared by the senior homeopaths. And there's lot many information available online as well. You can psychoanalysis of the physical symptoms, you can go through online as well. And in my experience, what I have seen, I've shared with you.
Thank you so much, sir.
Yeah, thank you. Any other question?
Yes, sir. Khushbu Agrawal asks, sir, if a patient is presenting bleeding per rectum, even if the complaint is chronic, in such cases, can we give acute remedy to stop bleeding pain first, followed by constitutional remedy?
See, answer is like if you're very confident of constitutional remedy, better stick to that remedy. And you can give acute mother tinctures, you can give like hemamelis or millifolium. There are many mother tinctures available, depending on the case to or collinsonia. Uh, that will help to control the acute episode without interfering the constitutional remedy. That is how I do. If you are confident, but if you are not getting response from constitution, then better reevaluate the case again. Try to understand the case in a better way. Try to ask more questions to the patient, and better arrive at some other deeper acting constitutional remedy if the case is very chronic one. Instead of giving some acute remedy, better reevaluate and come to some other constitutional remedy if it is not responding. In the meanwhile, you can use some mother tinctures to control the bleeding. That's what I do, yeah. Could you elaborate on third, fourth cup methods? There's a whole YouTube video. You can search Doctor Master and fifth 5-cup method. You can get the instructions how to give that medicine using 5-cup method. Lakshmi. Yeah, any other questions?
Anyone has any other question?
Sadia, yeah, Sadia, you can ask, yeah.
Sir, uh, do we advise any specific mother tincture local application in cases of fistula or sinus?
Yeah, you can use echinacea and calendula dilutional form to clean the wound, or buy seeds bath. You can advise that way. But really doesn't help much. Trust me, I've seen advising. But unless your remedy is not correct, nothing externally really helps in such cases. Any more questions? Anything on lachesis you want to ask? Please ask if you want to. Whatever in my knowledge I can share with you. So
Sir,
even
what
I
about
was not aware that lachesis is cannot be loquacious. You know, this case initially, honestly, I prescribe on the totality repetization. When no remedies worked, then I gave lachesis and I saw wonderful result. And then I re-evaluated the case and tried to understand the mental picture of lachesis. From that, I came to know that lachesis is 3 marks in silent grief. And lachesis can be that secretive. Other clinching picture was hatred towards the mother. Even though mother was taking good care of him, he was very much against his mother. He doesn't like his mother, and jealousy towards his brother as well. So grief part was there, but this jealousy, suspicion with hatred was very marked. So that's what it led to lachesis or any other animal remedy, you know. And abscesses, lachesis, trust me, if indicated, lachesis works wonderfully well. You can see the herring indications. You can read through herring guiding symptoms. You can get a lot of indications of lachesis in abscesses. Okay, any more questions? So we can. So if
Yes,
no
sir. I
question,
don't see any further question.
yeah, fine. So we can end the session. I would like to once again thank Healing Harmony for giving me this opportunity to speak on this platform and sharing my personal experiences with these 2 cases in anorectal conditions.
Thank you
That's
so much, sir.
yeah. Thank you
Thank you
so much.
for, I'm glad that we had you on our platform and we
Thank
look
you,
forward
Basant.
to having more from you.
Yeah.
Thank you so much, everyone, for
So thank you,
joining.
everyone. With this, I'll say goodbye to everyone. Yeah, we'll end the session. Thank you.
Thank you.